Welcome back to The Blend on this Wednesday. Now, many of us know someone who has struggled with addiction. The good news is help is available. Desert Hope Treatment Center here in the Valley provides just that with their intensive outpatient care program.
That's right. And here with more is Earl Hopkins, Desert Hope's regional manager. It's great having you back.
Good morning, Sean. Good morning, Megan. Thanks for having us.
To you.
Now, a lot of people don't know the difference when it comes to treatment, when it comes to addiction. Explain the differences if you can.
Well, addiction, when people are they need a way out. And so we come in as a resource for them to address their addictions. And we do that through different services that we have and able to offer our patients.
Correct. And there's a difference between inpatient care and outpatient care. Can you describe the difference in the two?
Absolutely. When people come into inpatient, think of someone coming into a hotel and checking in and staying for an extended period of time.
Right.
So they actually live with us, they reside with us, and they get acute care. They have access to 24-hour physicians and nurses. When you think of outpatient services, people get to stay at home. Their life is normal, there's no interruption, but they get to actually address addiction issues that they've been dealing with for a long time in a structured environment, yet they still get to go to work and carry on normal duties.
And that's why it's so popular, is because you kind of get to keep that normalcy.
Correct.
Yeah.
In addition to that, you get to keep your privacy. You get your confidentiality.
Yeah.
You're coming in, seamlessly. Your life is not interrupted.
Right. Does a patient get to choose? Hey, I'm coming in. I either check myself in, or I want to get care from home. Or does sometimes in some incidents, does a patient have to be checked in for inpatient care?
No, actually, we have an option called outpatient. So in the outpatient option, they don't have to absolutely, they're not checking in. It's a voluntary option for them to come in because they have issues they need to address. So this is like the beginning stages for them to come in and address these issues.
And if outpatient care doesn't work at some point, then are they forced to do inpatient? I guess that's more of my question.
It's never a forced issue. It's always a voluntary issue. So let's look at outpatient as the entry point. Okay, I'm on the fence. I know I need help, but I don't know where to go. I don't know where to start. But this is the opportunity for me to go get my feet wet. Jump into the pool, test the waters. If I fail at that, if I need a higher level, then that option will be available to me.
Absolutely. Some people might not think that they can get the same quality care as outpatient from their home, but they can.
Absolutely. Think of it like this. It's intensive outpatient services. So you get 3 hours of treatment per day, about 3 to 5 times a week. So you get the same structure. The only difference is you get to stay at home and nothing in your life from the outside or the exterior actually changes.
There's a long spectrum of addiction, right? There's people who are slightly addicted, there's people who are intensely addicted to something, whether it be drugs, whether it be alcohol. How many different options are there out there for people to get addicted to? I imagine that spectrum is huge.
Well, if you look at people that walk through life, we have this thing called process addictions. So people can go shopping, right? They can be in relationships, and sometimes these things get a little distorted where they become obsessed with these behaviors. And in turn, they actually translate into addictions. And so at that point, in that juncture, those things need to be addressed. And that's where professional help and seeking that assistance can be very paramount.
And I think it's important to note that it's a safe place to reach out to as well. I think a lot of people, they feel very intimidated if they are somebody that's struggling with addiction. They feel afraid to leave what is somewhat comforting to them, although it's not healthy for them.
Right.
And to know that there's someone that they can reach out to is a very important thing.
And to not be ashamed.
Absolutely.
To get the help, right?
Yes. And when I think about first responders, for example, they're helping a lot of people every day. And you would be surprised at the magnitude of people across the country that are in the first responders positions that need help as well. So we're there for the first responders. We're there for people who believe that, it's a shaming thing for them to ask for help. But there's absolutely help for them. There's no shame in saying, I need help.
Right.
My life is not going the way I planned it, and I would like to get help. And we're there in a safe environment to deliver that service for them.
At what point does someone know that they are addicted and not just they just really enjoy something? How do you know you're addicted to shopping?
Well, when it gets to a point where you're losing control and things are starting to get out of hand. In other words, your debt is mounting. You're causing issues through that behavior in your family. There's questions that are coming up. Why are you spending that money? Why are you drinking that much? Why can't you just be normal? And you actually try to engage in normalcy, and yet you cross that line every time. You may start out, I'm going to have 2 drinks tonight, but you end up having 6 drinks. So you've lost the ability to control what you do.
And if somebody wants to reach out and get more information about your services, they can go on your website and give you a call.
Yes.
Awesome. It's great having you back.
Thank you
so much.
Have a great day.
Thank you, sir.
Thank you so much. You want to find out more about Desert Hope Treatment Center's intensive outpatient care, you could just call the number or head to the website on your screen. They're also on Facebook and Twitter. Really important stuff. On